Hello, I'm Dr. Dennis Hartlieb with Dental Online Training with another clinical tip and product review for the restorative dentist. Today we're going to be looking at a material called EXACLEAR. EXACLEAR is a product from GC and it is a clear PVS material. It's been around for a long time. Most recently, a lot of dentists are wanting to do injection mold technique, and a clear translucent putty material is very helpful or maybe even necessary for when you're going to do this injection molding. So we want to look at our EXACLEAR and see how this material would hold up for doing things like injection molding. So let me show you the product. It comes in this cartridge, this dual barrel, 51 grams in the cartridge. I already have it loaded up in my gun. The key when you use these type of materials, when there are two barrels like this, you have a catalyst and a base, you want to make sure that you bleed before you start to make sure that the materials are running equally. And then you're going to place on your mixing tip, and then we're ready to roll. This is going to be the model that I'm going to use. There's a little Vaseline on this model because this material tends to stick to this rubbery plastic material. And I have this tray that we're going to use for being able to make our putty matrix. We're going to go ahead and bleed our material first. It's difficult to tell with these clear materials that it's running uniformly, but you always want to bleed these materials. All right, this tray is a full arch tray, but we just need it for these interiors. So we're going to go ahead and load our tray, keeping the tip of the syringe down into the tray. We don't want to lift up the tip. That's more likely to cause us some voids or some bubbles underneath. So we go ahead and we're going to just go through the anterior zone. And I'm going to take some of the same material, I'm going to put it over top of the model. Onto the teeth. Set the material to the side. Now when I make my putty matrix, I want this to be centered inside the matrix. I want to leave several millimeters, maybe about 5 millimeters or so, along the incisal, and several millimeters from the facial. Center it on the tray as much as we can. And then we'll hold it in place. The working time with this material says about 45 seconds, and it says on the instructions it's about a 2-minute set in the mouth. Now in practice, I would put this into a pressure pot. The pressure pot would help reduce any opportunities for any voids or air bubbles that could be inside the material, and actually condense the material so we get a better impression of the shape of the teeth and into the embrasures especially. On the bench top, I would expect that this will take about 3 to 4 minutes for it to set up before we're able to remove the model. After several minutes, we're able to remove the putty from the tray, gently lifting up. And as we look, you can see there are some bubbles, but again, I think this is the nature of not placing it in a pressure pot. If you have a pressure pot available, I absolutely recommend with any of your PVS materials that you're using for putty guides or putty stents to place it. Once you put it on the model, your putty, place it in a pressure pot, 10 to 20 psi for about 4 to 5 minutes. All right, now as we pull off, we see we have some excess. That's just the nature of the tray that we used. We'll pull this away. What I like about this EXACLEAR material, it has nice rigidity, but it is also very clear. Now, the clearer the material that you have with your PVS materials, the less rigid they're going to become. So it's a little bit flexible, which we would expect with any of these clear materials. And there's a few air bubbles. Again, that's to be anticipated when we're not putting it into a pressure pot. But overall, I think that it's a nice material. It's worked well for us in our practice for years. To trim any of these materials, you just need to use a fresh blade. And we're going to cut off the distal portions. You can see that it cuts very nicely. It's an easy material to work with. Checking it back onto our model after trimming. And I think that works pretty nicely, nice and stable. The clearer that your PVS material is, the less rigid it's going to become. But all in all, I think if you're going to be using EXACLEAR for your injection mold technique, you're just going to have to make sure that it's a little bit thicker to make sure you have the rigidity so that when you're injecting the flowable composite, it doesn't overextend your PVS material. We're going to be using this clear customized putty matrix when we do an injectable mold technique using G-ænial Universal injectable. So look forward to as we use this material, but in the meanwhile, nice material, has great clearness to it, but again, you lose a little bit of the firmness because of how clear it is. Just make sure if you're going to use this material that you make sure that your putty's a little bit thicker so that it doesn't flex on you when you're doing your injection mold. That's it for now. I hope you enjoyed this information on GC's EXACLEAR, and I look forward to seeing you next time. Yours for better dentistry, I'm Dr. Dennis Hartlieb.